Okay, so we are discussing today about female reproductive organ. The female reproductive organ is not only the female genitalia, just like male genitalia, there is female genitalia, as well as the female breast is also considered to be the female sex organ. Breast, in other words, we say mammary gland is the property of every mammals in the world. So we are considering now about the female genitalia, female genital organ. Okay. In this contents of this lecture include female external genital organs called vulva, pudendum commonly, of which I want to describe with you about vagina. Okay, the entrance of uterus. I mean the entrance of female internal genitalia. Okay, not uterus. And the internal female genital organs include, the parts include cervix, uterus, fallopian tube, ovary, etc. I will describe everything in detail in this lecture. So the parts we have to explain as an initial intro in this lecture is vagina, cervix, uterus, fallopian tube, ovary. Just familiar is the term. I will show you with the diagrams and everything later. Now, in addition to this, we also discuss in the lecture about adnexal structures, some ligaments that support the uterus. You know, ligaments not only connect within bone, there are ligaments that support the uterus also. The position of the uterus, where in anatomical position of uterus, where it is located, where it is in between, what are the structures and everything. And about the pelvis, I will discuss a little bit. And the blood supply and the nerve supply of the female reproductive organ. These are the contents of our lecture today. Okay. Now, think about female reproductive organ. As I told you, there is external genital organ, I mean vulva or pudendum to the female genital part. As well as you can see the internal genital organ here consists of uterus, ovary, and this fallopian tube. You can see the fallopian tube, ovary, uterus, cervix, etc. This is vagina. Vagina, don't think that vagina is a part of external genitalia. It's a part of internal genital organ. Anyway, I'm telling the opening of vagina is present in external genital organ. You see here, just wait. The external genitalia has an opening known as vagina, and above the vagina there is urethra, and the vagina and urethra, and just more extreme, and you can see clitoris. It's not an opening, it's the erectile tissue, and the clitoris, urethra, and this actually external genitalia is a part, is a urogenital organ actually. Urinary system and genital opening together it comes, and it's enclosed in a fold known as labia. Labia majora is there, labia minora is there, mons pubis is there. That you know, I think. Okay. So under reproduction, we have to consider only the vaginal opening. Okay. So vaginal opening is present where external genitalia. Now think about, just wait. The internal genital organ. As you know, the parts are vagina. Vagina, vagina, after vagina, it will continue as cervix. Cervix is a part of uterus actually, uterus. The neck of uterus is called cervix actually. Of course, histologically, the internal cells, internal lining cells, everything is different in cervix, but you can consider it as a part of uterus maybe. So that you see, cervix is actually a part of uterus. Then more than that, you have to see the ovaries here, and from ovaries you can see the fallopian tube and the major uterus also, body of the uterus. I will see the parts of uterus and everything I will explain later. So this is what our internal genitalia. So internal genitalia of female consists vagina, cervix, uterus, fallopian tube and ovary, as you learned in the basic class, I mean the school classes. Okay. So now, again, I'm going to repeat that. What's the shape of the uterus? This is a cross section of uterus. This is its sagittal section or coronal section. This is sagittal section actually. In sagittal section, you will see it's inverted pear shape. Inverted pear shape is the shape of the our uterus, and it's not the pear shape usually. You have to select that inverted pear shape, and you have to see vagina, cervix, uterus, fallopian tube, ovary, as I described you before. This is ovary, this is fallopian tube, this is uterus, This is cervix and this is vagina. Okay. Now, let's consider one by one. Okay. First of all, I'm dealing with the vagina. Vagina is you can see here, this diameter of vagina is only up to that. But when it can be enlarged its diameter, I mean it's an elastic tube, or otherwise we can say in medical term, fibromuscular tube, fibromuscular tube, made up of muscle tissue as well as fibrous tissue. Now, the inner lining of vagina is made up of stratified squamous epithelium. Stratified squamous epithelium. Where you had the stratified squamous epithelium before? Of course, in skin also there is stratified squamous epithelium. So, vaginal inner lining is made up of stratified squamous epithelium. Is it keratinized or non-keratinized? It is not keratinized in vagina, but keratinized in skin. That's the difference between the skin, the inner lining of vagina and our skin. Skin, there is keratinized, but here it is non-keratinized, no keratin deposition over the inner lining of vagina. But in skin, you can see the keratin deposition. So you can see this inner lining of vagina I just explained. So what are the point you have to remember? Vagina is a fibromuscular tube and is lined with a stratified squamous epithelium, just like this kind of epithelium, squamous epithelium, and is non-keratinized actually. Now more than that, just wait. If you look at the wall of the vagina, see, I'm drawing here. This is actually the anterior wall. Anterior means front portion. This is what? Posterior wall. Can you see? The posterior wall is a little bit of elongated. I want to tell that anterior wall is lesser than posterior wall. Or otherwise, posterior wall, this is posterior wall. Posterior wall is elongated than anterior wall. Who touches the, which wall? Anterior wall or posterior wall? Which touches the cervix? Of course, this region you can see. The anterior wall touches the cervix. So the posterior wall is adherent to, can you see this green covering? This is actually peritoneal covering or serosal covering. So the posterior wall at the upper end, there is covered with the serosa. Any other side, there is no serosal covering to vagina. This green portion is called the serosal covering. The serosal covering only present over this region only. This region is called cul-de-sac, pouch of Douglas and everything I will describe you later. So at the region of cul-de-sac only, the posterior vaginal wall is covered with the serosa. Any other part of the vaginal lining, whether anterior lining or posterior lining, is not covered with the serosa. And that's what I want to tell you in these points. Posterior wall is elongated than anterior wall. No serosal covering, but except at the region of cul-de-sac, or we can say cul-de-sac as pouch of Douglas. I will explain later that thing. Anyway, serosal covering only at the upper end of posterior wall only. Okay, more than that, the anterior vagina is attached to the cervix. Which wall of vagina is attached to cervix? Somebody asked you how to answer it as anterior vaginal wall. You can see here, it's attached here. Okay. Now, next point. What's the length of vagina? Just wait. Length of vagina is about 7 to 9 centimeter. The pH of vagina is acidic. Wow, the vagina has an acidic pH. Actually, an interesting fact behind that thing is actually, there are secretions in the vagina, secreted by the cells of the vaginal wall. They secrete some secretions known as glycogen. This glycogen undergo fermentation by the bacteria inside the vagina, lactobacillus. So the lactobacillus present in the vagina undergo the glycogen undergo fermentation by the lactobacillus present in the vagina, and the acidic pH is maintained. That acidic pH is about 3.5 to 4.5. Okay, so acidic pH is actually provide defense. Under this acidic pH, majority of the microbes not able to live. Therefore, it's a defensive mechanism. And lactobacillus, which ferment the glycogen secreted from vaginal cell into vaginal cell, and that convert this lactic acid. This lactic acid is responsible for this acidic pH of the vagina. Okay, now you understood. Now, then I want to discuss with you about secretions of vagina. Secretions. Okay, I told you there is secretion, glycogen secretion. Just like that, this kind of secretion happens from the vaginal epithelium. More than that, some alkaline secretions also there, but these alkaline secretions will be minor in compared with the acidic secretion, acidic environment. Okay, so under during sexual stimulation, there is a gland, namely Bartholin glands inside the female. This Bartholin glands also secrete some alkaline fluid, and also the cervix. If I show you the cervix has two parts actually. And the endocervix, you can see this region is called endocervix. This region. Endocervix will produce alkaline mucus also. I will discuss the cervix in detail later. So the secretions that influence the vagina include the normal vaginal epithelial glycogen secretion, and Bartholin gland secretion during sexual stimulation, and endocervical gland alkaline mucus also come to the vagina like this. Okay, so these are the secretions. If I go back, you can see here what are the things I told you. Vagina is a fibromuscular tube made up of stratified squamous epithelium, and its anterior wall is lesser than posterior wall, and the serosal covering only at the region of cul-de-sac. Cul-de-sac, what do you mean by cul-de-sac? Cul-de-sac means a narrow passage in the street where one end is closed. That is cul-de-sac. Or in other ways we can say pouch of Douglas. This region is actually, let me tell that region, the region between uterus and rectum we say cul-de-sac, okay, or pouch of Douglas, okay, or recto-uterine pouch of Douglas, you can say. I will tell later. Okay, so these are the things actually regarding the things. Which wall is attached to cervix? Anterior wall. You can see here anterior wall is attached to cervix. More than that, what I told you, what is the length of vagina? 7 to 9 centimeter. More than that, just wait. What is the pH of the vagina? pH of the vagina is actually 3.5 to 4.5. This is due to lactobacillus producing lactic acid from the glycogen, and this provide defense against microbes. Okay, you understood. Now, what are the secretions that present in vagina? Transduction of fluid from across the vaginal epithelium, Bartholin gland secretion during coitus, and more than that, endocervical glands that produce alkaline mucus. So, the first two are alkaline, but this one produce an acidic environment. Okay. Third one. Now that's over. Now let's discuss about this right. Cervix. Cervix, you can see in the diagram, this is what cervix here. Cervix. Cervix is actually the neck of uterus. The neck of uterus is called cervix. It has two parts. Can you see this part? Better to show you in another diagram. It has endocervix as well as ectocervix. This part is called endocervix. Then what part is ectocervix? This part. This is not the part of vagina. This is ectocervix. Actually, these two places, this you can see green color. I have shown with green color here. Ectocervix and endocervix are the parts of cervix. Ectocervix is lined with some other kind of cells, and endocervix is lined with another kind of cells. Anyway, ectocervix is lined with our, just like vagina, stratified squamous epithelium. Simply says squamous epithelium. Ectocervix, just like vagina, is lined with a squamous epithelium, but endocervix has columnar epithelium. You can see the columnar epithelium of endocervix. So there will be a squamo-columnar junction. There will be a squamo-columnar junction in between ectocervix, and ecto means outside, endo means inside, between ecto and endodermis. Not dermis, I'm sorry, ecto and ectocervix. Okay. So more than that, I want to tell two more terms. This is external opening, therefore external os. This is internal opening. It's called internal os of cervix. External os, internal os. Between external and internal os, endocervix, and this is actually ectocervix. Okay, you understood. Which is lined with columnar epithelium. It's lined with columnar epithelium is actually our just wait. The columnar epithelium is lined endocervix, and the other one is actually ectocervix, squamous epithelium. Let me tell in detail. Endocervix is lined with columnar epithelial cells, ectocervix with a stratified squamous epithelial cells. So you can see a squamo-columnar junction between ecto and endodermis. And I want to stress this point because of the fact that, just wait, sometimes there will be an invagination of these squamous cells into these columnar cells. That I am telling in a literal manner. Actually, what happens is that some columnar cells undergo a process known as metaplasia, in which columnar cells become squamous cells. This is a differentiated cell actually, columnar cells. These undergo T-differentiation. Again differentiation. Go to stem cells and again differentiation happens. This is a very, very dangerous thing actually. We call it as metaplasia. Metaplasia means T-differentiation. The columnar cells undergo another differentiated cell. Already differentiated cell is the columnar cell. That have become another differentiated cell, denotes metaplasia of the columnar cells into squamous cells. That will produce a squamous region inside the where endodermis. Actually, this yellow color you can see that's squamous epithelium. You can see here, and this what is the color actually? Columnar epithelium, which is this thing. Okay, so there's a columnar junction is there, but if it is become in this region, if it becomes squamous, what is the property is that metaplasia has happened. So you can see here this light red color is actually represent what the squamous cells, and this dark red color represents the columnar cells. There is a columnar junction, but when there is a metaplasia happens, some amount of columnar cells become squamous cell, but it happens, but it will result in a region known as, just wait, I will show you that thing, transformation zone. Can you see? Transformation zone has formed between. Transformation zone is actually in between endodermis and ectodermis. Sorry, in between endocervix and ectocervix. It's actually transformation zone. Transformation zone, what's the histological process that happened in transformation zone? Metaplasia. Metaplasia of the squamous cells, sorry, metaplasia of columnar cells to squamous cells. This is a precancerous lesion, precancerous condition. This easily convert, this transformation zone are very, very vulnerable to dysplasia. I want to tell that cervical cancer. Otherwise you can say cervical intraepithelial neoplasia. So this is what cervical intraepithelial neoplasia. It will lead to cervical cancer. Okay, you understood. So this is what I want to tell. Endometrium, endocervix, ectocervix. In between endo and ectocervix, there is a columnar junction. But when it leads to metaplasia, it's become a transformation zone, which will become CA cervix. I will show you some photos of CA cervix. You can see this kind of CA cervix will happen. Just wait. CS cervix will happen only because of the fact that there is metaplasia of at a columnar junction. Then what happens is that metaplasia of columnar junction is called cells to squamous cells. Okay. Now let's think about uterus. Uterus has body of the uterus. You can see the body of the uterus. This is main body of uterus. Uterus has fundus. There's a question that which part of uterus not involved in birth canal. This is the area there where birth canal is formed. So the birth canal does not involve this fundus of uterus. Anyway, cervix is involved, lower part of uterus, body of uterus is involved, but isthmus I will tell you later. Isthmus and everything is involved, but fundus does not involve in birth canal. Now, if you look at the position of uterus, anterior to the uterus, what you see? Anterior to uterus, anterior means front portion. You can see the bladder. And what is posterior to the uterus? It is the rectum. Anterior to the uterus, bladder. Posterior to uterus, there is rectum. Okay. Now, as I mentioned before, what's the shape of, just wait, what's the shape of the uterus? It's pear-shaped or pyriform shaped. Parts include fundus. Where is fundus actually? This part of uterus is called fundus. And body of the uterus. You have to remember that body of the uterus is also called a corpus. Now I will tell corpus, something like that. Corpus is actually body of the uterus. And the cervix already described with you. Now, more than that, isthmus is there. Isthmus is really a significant point histologically. I will tell that thing. Isthmus. This part is also called isthmus. But this part is actually lower part. Here there is a contradictory aspect between. I will tell that thing. You can see here. Just wait. The thing is that area between, this is the area of anatomical os. Anatomical internal os. You know that there is external os and internal os is there in the cervix. This is anatomical internal os. And this is histological internal os. What is histological internal os? Histological internal os means at this region this columnar cells of cervix is changed into other cells of the uterus. This is histological border. At this border, the uterine cells and cervical cells are changing. This is a junction of that cell region. But here, the anatomical opening is actually internal os. So the region between anatomical internal os and histological internal os, you understood, I think. Anatomical internal os means this region, but histologically it's already changed here actually. So this region is called isthmus. Isthmus. Okay, you understood, I think. Now there is another part is also. This part is very important because of the fact that several things attached. This part of uterus. This part of uterus is called a cornu of uterus. Cornu of uterus. This part where fallopian tube enters the body of uterus, we say cornu of uterus. So some terms you may be difficult for you. I will repeat once more. You see, body of uterus is called corpus, and this region is called cornu of uterus. Body of uterus is called corpus. This region is called cornu of uterus. Isthmus is the region between anatomical os and the histological os, internal os. Now, corpus is the body of uterus and cornu is the region where fallopian tube enter to the uterine cavity. That is the cornu of uterus. We need that cornu. The term cornu we need. Okay. Now, for a formality, let me tell. Uterocervical length. Uterocervical length. Uterus to cervix length. Okay. Uterocervical length is actually 8 to 10 centimeter in mothers who have given birth to several babies, multiparous women. But those who are not given birth to any babies, the uterine length, cervical length is about 6 to 8 centimeter only. Okay. Now, corpus cervix ratio. What do you mean by corpus cervix ratio? Corpus cervix ratio means it's actually our body of uterus and cervix ratio. You remember corpus means this, can you see here? Body of uterus up to this and this one is up to this. You have to note in this thing is that at puberty, body of the uterus, I mean corpus and cervix is length is 1:1 ratio. But otherwise, before puberty, it's 1:2. Up to reproductive age group, it is 3:1. And after menopause, again, just like a puberty, it is actually 1:1. You have to study that. Puberty, body of the uterus and cervix, I mean corpus cervix ratio is 1:1. At reproductive age, it is 3:1 and 1:1 after the menopause also. But before puberty, it is just opposite. Cervix is lengthier and 1:2 before puberty. So at puberty 1:1, at reproductive age 3:1. You have to understand that thing. Okay. Now a simple concept I want to tell. You know this thing before I think. Perimetrium, the outer covering. Myometrium, the muscular middle covering. And the wall, okay. Endometrium is the inner wall. It's columnar and glandular cells and everything is there, which shed off during menstruation and everything, you know. Okay, perimetrium is a fibrous tissue and form the serosa and everything. But myometrium is made up of smooth muscle cell. What you have to note here is that in myometrium, some muscle fibers, smooth muscle fibers are like this. Another fibers are like this. This forms a living ligature. Living ligature. This is called living ligature because of the fact that you see here blood is going to these arteries and due to contraction of these muscles the blood get blocked. Now this cause ischemia in this uterine wall. That is the reason for pain during labor, uterine contraction. Okay, so living ligature is actually works just like a blocker of artery blood supply through the arteries so that there will be ischemia and this ischemic pain is the reason for labor pain. It has some significance. I will discuss when I got an opportunity later. Now, next thing about endometrium. Endometrium is actually, this kind of inner lining which shed off during menstruation and everything. I will describe later in any other lecture. Okay, now the peritoneal fold, that's very important. Just mentioned before the cul-de-sac, you remember. What is peritoneal fold? You can see the inside the peritoneum, there is all the viscera is covered. Okay, visceral peritoneum and this peritoneum is there. So the peritoneum can make a fold around the uterus. One fold is actually utrovesical pouch. Uterus, vesicle, bladder. So utrovesical pouch. This is a peritoneal fold in between bladder and uterus. You can see here. Whereas recto-uterine pouch. Recto-uterine pouch between rectum and uterus. The recto-uterine pouch of Douglas is also called cul-de-sac. Cul-de-sac means a narrow passage through the street where one end is blocked. So this is cul-de-sac. So you have to say from posterior to anterior side. For example, recto-uterine pouch of Douglas and utrovesical pouch. Understood? Recto-uterine pouch of Douglas and more than that, utrovesical pouch. Two pouches in between that covers the uterus actually. Okay. Now the fallopian tube I want to discuss. When you think about the fallopian tube, just wait, it has isthmus. The same term we also discussed in between anatomical os and internal os and histological internals. Anyway, this part is also called isthmus, and this is our ambula, dilated portion of this fallopian tube ambula. What is the significance of ambula? You may heard about in simple lower classes. The thing is that it's the site of fertilization. It's the site where ovum meets sperm. Okay, and the infundibulum, the funnel-shaped part of fallopian tube is a infundibulum, and this is our fimbria. The fimbria is finger-like projections to the abdominal cavity. We say fimbria. Fimbria will be responsible for the ovum capture from that's released from the ovary. When ovum is released, the fimbria will do the capture of that ovum, and it will go through this thing. And at the ambula, it gets fertilized. And I will tell everything regarding fallopian tube in the coming slides. Okay. So fallopian tube also from what's the function of fallopian tube? Can you see here? The fallopian tube, the ovum is moving, and the fertilization has happened. Zygote, embryo is everything is moving until it gets implanted in the uterine wall. So that fallopian tube is also promote the movement and nourishment of the zygote. Movement and the nourishment of the zygote is also promoted by the fallopian tube. One is movement. How the movement takes place? You have the ciliated columnar epithelium on the wall. Ciliated columnar epithelium. This will help the movement of this ovum. More than that, nourishment is by the secretions from the walls of the fallopian tube. Okay, both nourishment and movement is of the zygote is provided by with our fallopian tube. Now, regarding the ovary. Ovary is the size of ovary. Somebody asks you 3 to 1 centimeter, 3 centimeter, 2 centimeter, 1 centimeter dimension. Okay, outer has cortex and inner has medulla. Medulla contain blood vessels, but outer cortex is very significant. It has ovarian follicles. You know, from oogonia, some kind of ovarian follicles are formed, and the ovarian follicle will rupture and release the ovum. Rest of the part become corpus luteum. Everything I will discuss in somewhere else. Okay, so this is what ovary, the site of production of ovum, site of production of estrogen and progesterone. Okay, it has endocrine function as well as this reproductive function. Now that's over. Every structure is over. Now I want to discuss some other structures. Adnexal structure. Adnexal structure means one is adnexa itself. Adnexa means what do you mean by adnexa? Adnexa is actually our ovary and fallopian tube. Ovary and fallopian tube together we call adnexa. Okay, adnexa. Okay, I'll show you this thing. See, this is adnexal tumor. Adnexal tumor means what? Adnexal tumor means the ovary and fallopian tube tumor. That's what the adnexa. Ovary along with fallopian tube together we say adnexa. Next structure of this adnexal structure include utero-ovarian ligament. What do you mean by utero-ovarian ligament? Utero-ovarian ligament means the ligament. Ligament means the bones are connected with the ligaments. Just like that, this kind of structure is also connected with the ligaments. Okay, it's also called ovarian ligament. From uterus to ovary, there is a ligament. It's known as utero-ovarian ligament or ovarian ligament. I will show you the ovarian ligament later. Broad ligament is a very broad ligament. I will tell you later. Okay. Now, suspensory ligament is the ligament that suspends the uterus on the pelvic cavity. And you have to know about round ligament of uterus is also. Round ligament is also very important. I will tell one by one. So 5 structures under adnexal structure I want to describe with you. You see here, one is adnexa. Adnexa is actually the adnexal tumor, you can say. Now another one is actually utero-ovarian ligament. Utero-ovarian ligament. You can see here. This is actually uterus. This which part of uterus is this thing? Cornu of uterus. You can see fallopian tube here, and this cornu of uterus. Another structure is attached. It's utero to the ovary. Utero-ovarian ligament. Utero-ovarian ligament between cornu of uterus to the cornu of uterus to ovary. It's actually the utero-ovarian ligament. So you studied about adnexal structures, ovary and fallopian tube, and more. Adnexa. I mean ovary and fallopian tube. Another one is utero-ovarian ligament. And the third one I want to discuss under adnexal structure is actually broad ligament. This yellow ligament is called broad ligament. Very broad. Since it is very broad, since a country has different states, just like that, this broad ligament has different regions. I will tell you that are the different regions of this broad ligament. You can read this thing. Mesoovarium, the part of ovarian broad ligament where ovary is located. Ovarium. Mesoovarium, part of broad ligament where there is ovary is located. Mesometrium, body of metrium is regarding the uterus. So that the part of broad ligament where body of uterus is located. Mesosalpinx means fallopian tube, the part of broad ligament where fallopian tube is. So you have three regions in the broad ligament: mesovarium, ovary; mesometrium, uterus; mesosalpinx, the what mesosalpinx, the fallopian tube. So this is about the broad ligament. So what are the things I told you? Adnexal tumor, I told you, it's ovary and fallopian tube. And the utero-ovarian ligament between cornu of uterus and ovary. And the broad ligament of uterus, I mean it's actually our broad ligament of uterus is actually our the very broad ligament you can see here, and it has some parts like mesovarium, mesometrium, mesosalpinx, etc. And the fourth part in the adnexal structure is suspensory ligament. Suspensory ligament. Suspensory ligament is part 2 here. You can see this is one. This is what? Tube or utero-ovarian ligament, ovarian ligament. Suspensory ligament is this one. This one is the part 2. This is suspensory ligament. Okay. Suspensory ligament is also called the infundibulopelvic ligament. Extension of broad ligament. It is an extension of broad ligament. It attaches to infundibulum, then to the pelvic wall. This pelvic wall, so that what happens is that it will suspend the ovary. Suspensory ligament will suspend the ovary. So let me tell once more. You see, what is this thing? This is our utero-ovarian ligament, uterus and ovary. This is suspensory ligament of ovary. Heard about that thing? Suspensory ligament of ovary. Suspensory ligament of ovary is actually extension. Here the broad ligaments are there. Extension of broad ligament, then the infundibulum, then it attaches to pelvic wall. That is what our suspensory ligament of ovary. So I want to repeat what are the structures I told you up to now. Adnexa means ovary and your fallopian tube. Then utero-ovarian ligament. Ovarian ligament means utero-ovarian ligament, cornu to ovary. Then more than that, the broad ligament. Then suspensory ligament. Suspensory ligament, this is our ovarian ligament. I mean utero-ovarian ligament. And this is actually suspensory ligament. That suspends that attached to pelvic wall here. Pelvic wall to ovary it is attached. Infundibulum, broad ligament part. And this is actually the suspensory ligament of ovary. Okay. Now think about the round ligament. The last ligament under adnexal structure is round ligament. The figure itself clearly explains this round ligament. See, this is our round ligament. Round ligament. Our round ligament is this one. So round ligament is actually structures attached to cornu of uterus, include erectometal. See, this round ligament is also attached to cornu of uterus here. Okay. So fallopian tube is attached to the region. Ovarian ligament, I mean utero-ovarian ligament is attached to this cornu, and round ligament is also attached to this cornu. So three structures are attached to cornu of uterus. One is fallopian tube, another one is our ovarian ligament, this ligament, ovarian ligament, and another one is our round ligament. Easily miss this point. Round ligament is also attached to cornu of uterus. So if you tell the course of round ligament, it is attached to cornu of uterus, travels through the broad ligament. Then what happens? I will tell. The course of round ligament is a special topic for you. Okay. Now, so the adnexal structures are adnexa. What is adnexa? Ovarian fallopian tube. Utero-ovarian ligament, otherwise called ovarian ligament. Broad ligament of uterus, suspensory ligament, not uterus actually, I'm sorry. Suspensory ligament of ovary, and round ligament of uterus is also there. Okay. Now, these are the ligaments present at the adnexal structure. But some ligaments are there to support the uterus. You know, uterus can be expanded. Even that time, uterus should be well supported. The support of uterus, otherwise herniation will happen. Okay. So support of uterus is by one endopelvic fascia. Endopelvic fascia. Endopelvic fascia is this one. You can see here. Just wait. Endopelvic fascia is actually there. Endopelvic fascia inside the pelvis. Endo means inside. Endopelvic fascia is condensed and formed like this. This is what endopelvic fascia. Endopelvic fascia is very important. Endopelvic fascia that hold the uterus there in position. Not only the endopelvic fascia, there are some ligaments. I will show you that ligaments first. Just wait. This is transverse cervical ligament. You can see the transverse cervical ligament. Transverse means, you understood what is the transverse? You understood? You can see these yellow ligaments are called transverse cervical, attached to cervix. So transverse cervical ligament. Then uterosacral ligament, uterus to sacrum, this ligament, uterosacral ligament. You can see uterosacral, uterus to sacrum. transverse cervical ligament, uterosacral ligament, and pubocervical ligament. You can see the pubocervical ligament. So these are the three ligaments I want to tell. Transverse cervical ligament, uterosacral ligament, pubocervical ligament. These are the three cervical. Let me tell once more. Transverse cervical. Okay. Pubosacral. Sorry, uterosacral and pubocervical. Understood? So these are the three ligaments that hold the uterus in position actually. You can see the transverse cervical ligament here. Here you can see the transverse cervical ligament, also called cardinal ligament or McIntosh ligament. Okay, whatever may be the name, its cervix to lateral pelvic wall is the attachment of this ligament. Now uterosacral from uterus to sacrum, posterior cervix to sacrum. Okay, so you can see that uterosacral ligament, posterior cervix or uterus to sacrum. Sacrum, you know, sacrum of bone, cervical bone, thoracic bone, lumbar bone, and sacrum and coccyx, that's sacrum. Okay, you can see the positioning uterosacral ligament in this figure also, from uterus and posterior part of cervix to sacral region, sacral promontory. Okay, now pubocervical ligament, another ligament is the pubocervical ligament. Pubocervical ligament is actually from cervix to pubic symphysis, anterior cervix to, you can see the figure, anterior cervix to pubic symphysis, it's attached along the side of bladder. You see pubocervical ligament here, one is here, one is here. Anterior cervix to the pubic symphysis, anterior cervix to pubic symphysis. That's what pubocervical. Let me repeat the ligaments. First ligament is actually, first is condensation of endopelvic fascia, then transverse cervical ligament, uterosacral ligament, pubocervical ligament. So in that order you have to say transverse cervical, uterosacral, and pubocervical ligaments. Okay. Now the position of uterus. You have to by heart that the position of uterus is actually anteverted and anteflexed. Anteversion and anteflexion. Anteverted, anteflexed uterus is actually the normal this thing. What do you mean by anteversion? Anteversion means the angle between vagina. You can see the vaginal angle here. Angle between vagina and the angle the axis of vagina and axis of cervix. Cervix and vagina form an axis around 90 degree. This is what anteversion. What do you mean by anteflexion? Anteflexion is actually the axis between cervix and axis between uterus. Anteflexion. This is actually about 120 degree. So these are the two angles I want to tell. 90 degree between the axis of vagina and axis of cervix. It's called anteversion. And anteflexion means the axis of cervix and axis of uterus. From outside to inside you go. Axis of vagina to axis of cervix is actually 90, and axis of cervix to axis of uterus is actually 120. So these are the two angles that normal uterus is anteversed and anteflexed. Then what is abnormal? If you study the abnormal, you want to know what is abnormal. Abnormal is actually retroversion. Anteversion is normal. 90 degrees normal. You can see which is out of which figure which is normal actually. This is normal. This is abnormal. You should say retroversion. Simply you can see that the uterus is positioned towards the rectum. Uterus is positioned normally it's towards the bladder, but it is towards the rectum now. It's called a retroversion. Retroversion of the uterus can be autocorrectable under physiological retroversion, but it can be a pelvic adhesion or scar tissue or tumor that compresses the uterus, anything like that. It can be there. Instead of this uterus is going towards the bladder, it is directed towards the rectum here. Very curious about this thing. I want to tell something else. Okay, you see here, anteversion is normal and retroversion is abnormal. Okay, this is anteversion and this is retroversion. How will you understand that thing? External or anterior lip of the, by finger examination, anterior lip is felt here. Anterior lip. Then it is normal. Anterior lip of cervix is felt with the finger examination. It is anterior, anteflexion. But retroversion, if you felt, what happens is that you will feel this is anterior lip and this is posterior lip. You will see the posterior lip only. So that's the difference. If you under finger examination, if you felt the anterior lip of cervix, it is anteversion. If you felt the posterior lip of cervix, it is retroverted. Okay. More than that, where this os is directed, external os, in normal anteversion, os is directed towards posterior side. But in retroversion or external os is directed towards anterior side. A little bit of confusion is there. Anyway, you understand when anterior lip is palpated, we can palpate with a finger examination. It is anteverted, and retroversion means posterior lip is palpated. This figure, these two figures clearly explain that thing. This is anteversion and this is retroversion. Okay. Now some pelvis, boundaries of pelvis also just telling that thing. Okay. You can see this is ovary. Where this ovary is located, somebody asked you where this ovary is located, you have to say this borders. I will tell. Superiorly there is external iliac artery and vein is there, and anteriorly there is broad ligament of uterus, posteriorly ureter, internal iliac artery and vein, inferiorly the obturator nerve artery and vein of everything. So inferior, this is important. Inferior to ovary there is obturator vessels and nerves. So when ovarian carcinoma or anything like that happens, what happens is that this obturator nerve get irritated. That may radiate, that pain may be radiated into knee pain. So ovarian carcinoma can present as knee pain because radiation of pain. When this ovary, below the ovary, you can see the this nerve get irritated. When this nerve get irritated, what happens is that this kind of problem will arise. I think you are okay. Now let me tell the previous that round ligament. You remember round ligament is attached to where? Round ligament is attached to the cornu of uterus along with the fallopian tube, along with a what is the other structure? Utero-ovarian ligament. There is this one also attached to cornu of uterus. This is going through the broad ligament, enter through the what's this? Inguinal canal. You have the deep inguinal ring and the coming through the superficial inguinal ring and attached to the labia. That's what labia majora. That's what the course of our round ligament. Let me tell. This transverse deep inguinal ring passes through the inguinal canal, terminating the labia majora, originating the cornu of uterus, run with the broad ligament across the pelvic floor of internal deep inguinal ring, and traverse through the inguinal canal, exit via superficial inguinal ring, termination as the fibrous fan-shaped blind with connective tissue of mons pubis and labia majora. So it's round ligament. Simple one. Labia majora, superficial inguinal ring, inguinal canal, deep inguinal ring, broad ligament of uterus, and more than that, the cornu of the uterus. That's the course of round ligament. Round ligament is also attached to cornu. Three structures are attached to cornu of uterus. Fallopian tube. What is the cornu of uterus? The part where fallopian tube is attached. Okay. More than that, the round ligament, and more than that, one more structure is there. This thing. This thing, utero-ovarian ligament. This ligament is called this suspensory ligaments of ovary. Okay, this is suspensory ligament of ovary. This is tubo-ovarian ligament. Okay, understood. Now some kind of complicated things I am telling. Blood supply, I am making it a symbol. Blood supply of female genital structure. You have ovarian artery to supply ovary, uterine artery to supply uterus, and two other arteries also there. To supply the lower part of vagina, there is internal pudendal artery and special artery, Samson's artery is also there. You have to study these four arteries. I will show you. See, ovarian artery is a direct branch of abdominal aorta. See, ovarian artery is a direct branch of abdominal aorta. Here is also it will be like this. Ovarian artery is a direct branch of abdominal aorta. That's important. Now, more than that, this uterine artery arising from internal iliac artery. Internal iliac artery has anterior division as well as posterior division. Anterior division of internal iliac artery gives rise to several branches. One branch is uterine artery. Okay, uterine artery gives rise to several other branches also. You have to remember that uterine artery is a branch of anterior division of, this is posterior division, anterior division of internal iliac artery. Anterior division of internal iliac artery. Okay. So the branches of this uterine artery, we are discussing uterine artery. First we discussed ovarian artery. Ovarian artery is this direct branch of abdominal aorta, and uterine artery has several branches. Ascending branch supplies to upper part of uterus. Descending branch supplies to lower part of uterus. And vaginal artery can be a branch of uterine artery or direct branch of this anterior division of internal iliac artery. Both are there. So this is actually the things I want to tell this thing. Ovarian artery is there, uterine artery is there. And the ovarian artery and uterine artery can be anastomosis each other. They are anastomosis. What is anastomosis? This kind of connection between two arteries called a anastomosis. They are anastomosis each other. Okay. Finger like a connection. Okay. So this is, more than that, I want to tell another artery. Samson artery. The third artery I want to describe is Samson artery. So I described with you about ovarian artery, direct branch of abdominal aorta, and uterine artery, which is a branch of what? Which is a branch of anterior division of internal iliac artery, and Samson artery is a special branch of uterine artery. It's again from artery. So what are the branches of uterine artery? It's actually passes through this ligament. What is this ligament? Round ligament. Can you see here? It will passes through the round ligament of uterus, Samson's artery. Okay, so what are the branches I told you? Ovarian artery is there, uterine artery is there. The uterine artery has ascending branch, descending branch. Even the vaginal artery can be a branch of uterine artery or not, separate or not, whatever. Maybe Samson artery is also a branch that will passes through what? Round ligament of uterus. Okay, now more than that, internal pudendal artery, the last artery is internal pudendal artery. You can see lower 1/3 of vagina is supplied by internal pudendal artery. Internal pudendal nerve, internal pudendal artery is that supplies the lower 1/3 of vagina. All these things are anastomoses in each other. Okay, so what are the blood supply? One is ovarian artery, uterine artery, Samson artery that runs through the round ligament, and internal pudendal artery, lower 1/3 of vagina. Okay, now I told you that this ovarian artery and uterine artery anastomoses each other. Can you see here? They anastomoses each other. But the uterine artery inside the myometrium divide into two branches, arcuate and the radial artery. That's the branches of inside the myometrium. It has this uterine artery, some two branches, and the inside the endometrium it has spiral and basal artery. I will tell in detail, just wait. You know what happens to uterine artery? That's what I am discussing. Uterine artery in the perimetrium is actually uterine artery itself, and can be anastomosis, ovarian artery and everything. Inside the myometrium it become arcuate artery and radial artery. I mean, the myometrium is supplied by arcuate artery and radial artery of uterine artery. So these are two branches of uterine artery, arcuate and radial in the myometrium, and endometrium has straight artery, I mean basal artery and spiral artery. This spiral artery, basal artery, everything in the endometrium. And you know how you get a mnemonic from this thing? Perimetrium U, myometrium AR, and endometrium SS. Whatever may be, it's actually uterine artery in the perimetrium, arcuate and radial. You can see the arcuate artery here. Can you see the arcuate artery? And radial artery, can you see? Arcuate and radial in the myometrium, and basal artery. Can you see the basal artery? Basal and spiral artery in the endometrium. Very weak arteries. Basal and spiral artery, or straight and spiral artery in the endometrium. Arcuate and radial in the myometrium. Okay. That artery may compress during uterine contraction. Okay. And that's living ligature I told you. You remember? Okay. This is actually a general picture of blood supply of our uterus and every reproductive system, female reproductive system. Okay. Can you see the ovarian artery? Ovarian artery is a direct branch of abdominal aorta. You have the uterine artery here, vaginal artery here, and spiral artery here, radial artery here. Everything is there. Okay. Now that's over. About blood supply is over. Now let's think about just wait, nerve supply of the genital organ. When you think about nerve supply of the genital organs, there are superior hypogastric plex, inferior hypogastric plex, and pelvic splanchnic nerves. The superior hypogastric plex is there. Inferior hypogastric. What does it hypogastric mean? This is in the stomach, below the stomach, the hypogastric region. Superior hypogastric plex and inferior hypogastric plex is there, and pelvic splanchnic. Splanchnic means inside the internal organ, you mean. Okay, pelvic splanchnic nerves also there. Let me tell you in detail. You know, let's look where is the superior hypogastric plexus are located. Just wait. You can see this is sympathetic trunk, not superior hypogastric plex. Aortic plex, not superior hypogastric plex. These are not. Can you see? This plex means a group of network of nerves. Okay, this is what superior hypogastric plex. You can see here. Superior hypogastric plex carry sympathetic fibers. They carry sympathetic fibers. We are discussing the nerve supply of female reproductive structures. Sympathetic fibers are carried by superior hypogastric plexus. It's also called presacral nerve, and divide into right and left hypogastric nerve. Can you see? They divide into, I will show you with another figure. See, superior, where is the superior hypogastric plex? Here you can see the superior hypogastric plex. This divided into right and left hypogastric nerve. Can you see the hypogastric nerve here? This is hypogastric nerve. So, right and left hypogastric nerves are formed from superior hypogastric plexus. Superior hypogastric plexus. Now, below that, you can see the inferior hypogastric plexus also. Before that, I want to tell something else. You see, superior hypogastric plexus, if it carries the sympathetic fibers, don't think that inferior hypogastric plexus carry the parasympathetic plexus. Instead, when superior hypogastric plexus carry the sympathetic fibers, the splanchnic nerves, I will show you that thing. Splanchnic nerves, pelvic splanchnic nerve, you can see here, pelvic splanchnic nerve carries the parasympathetic plexus. So sympathetic plexus are carried by superior hypogastric plexus and pelvic splanchnic nerves are carrying the parasympathetic plexus. The root value is S2, S3, S4. S2, S3, S4, you know the sacral root value. Pain from cervix and vagina ascend via this nerve. Which nerve? Pelvic splanchnic nerve. Pelvic splanchnic nerve carries the pain fibers of these things. Okay. More than that, just wait. Okay. No, the pelvic splanchnic nerves is carrying the pain fibers from cervix and vagina that's ascend via these nerves. Okay. So that's all about this sympathetic and sympathetic. Who supplies the sympathetic fibers? It's actually from superior hypogastric plex. And who carry the parasympathetic fibers? It's by the pelvic splanchnic nerves. Okay. Now there is another. You can see here the in detail about this in this figure. Just wait. You can see the in pelvic splanchnic pelvic plexus here. S2, S3, S4. Okay. And more you can see here also pelvic splanchnic nerves here. S2, S3, S4. Okay. Then superior mesenteric artery, inferior mesenteric artery, nothing else in we want to show you then. Inferior hypogastric plex. Can you see? Next thing we have to discuss. That's also there. I will tell that. Now you see the last one I want to discuss with you about inferior hypogastric plex. The inferior hypogastric plex carry fibers from uterus, not only uterus, rectum, bladder, vagina, urethra, all the places in this pelvic region. Inferior hypogastric plex has a broad distribution. And there is uterovaginal plex in special in the inferior hypogastric plex. I will show you that thing. Uterovaginal plex is also called a Frank-Hesser ganglion. Actually arises from this inferior hypogastric plex. Somebody, you got a question that's like Frank-Hesser ganglion or uterovaginal plexus arising from where? You have to answer it as it's from inferior epigastric nerves. Okay. Anyway, the pain arising from fundus of the body of uterus. You know, during labor pain there will be pain. That ascend not via pelvic splanchnic nerve, but it ascend via this plex. This plex means inferior hypogastric plex. It has a root value of T10 to L1. T10, 11, okay, you understand? T10 to L1 it is happens. So that this is inferior hypogastric plex. Can you see? This is inferior. So what are the nerve supply of uterus? The nerve supply of uterus include, it's not uterus and is female reproductive tract include, you know, superior hypogastric plex, inferior hypogastric plex and pelvic splanchnic nerve. Parasympathetic supply is supplied by pelvic splanchnic plex. Sympathetic supply is supplied by superior hypogastric plex. And the inferior hypogastric plex carry the pain fibers from fundus, body and everywhere. Then who carry the pain fibers from vagina and cervix? It's actually our by our pelvic splanchnic nerves that you understood, I think. Okay. And now at last, okay, you can, I will show you this subdivision of inferior hypogastric plex, this thing, Frank-Hesser or this uterovaginal plex. You can see here, this is what that plex, uterovaginal plex here. This is what uterovaginal plex here. Okay. More than that, I will ask some questions today. At last, you see here, you can see here, which artery forms the major anastomosis supplying the uterus? What are the arteries that anastomose around uterus? Answer is very simple. Is it superior gluteal, inferior gluteal? No. External pudendal, internal pudendal? Never. But vaginal artery and uterine artery? No. But it is ovarian artery and uterine artery. You got 1 mark. Now next one, just wait. Uterine artery is a branch of which of the following? External iliac, internal iliac, or internal external or internal pudendal or internal iliac or ovarian artery. You have to say anterior division of internal iliac artery. Okay. Now next question. Okay, that's all about. I think one more question is there. Okay, which one of the following not a component of birth canal? Lower uterine segment. It will form the birth canal. Birth canal means during delivery there will be a canal formation. Okay, baby will come through this canal. Okay, our cervix is there. The cervical expansion, everything happen. Vaginal canal is there, but fundus is upper side of uterus. It will not form birth canal as I described in the lecture. So that this is the answer of this question. So this kind of question you can expect, and very thank you for the watching my lecture today, and thank you very much. Okay.